you get sick, it's your body is struggling against an infectious disease. A lot of times we get infected, we don't even notice it because our immune system just knocks it away so easily. You already had a particular illness and you get it again, it's usually no problem. And that's what vaccines do. It makes, your immune system is so ready for a particular disease that it bats it away. So, but there of course are other diseases like HIV, like hepatitis, so forth, that are very strong, very pathogenic, they say, very deadly. And they attack the immune system in subtle ways that make it much more difficult for the immune system to defend you. And also those diseases have been resistant to our standard means of vaccination. So we've had these ways of making vaccines that go back to Pasteur, essentially. And they work great for many diseases, but they're not working particularly well for some of these other ones like HIV. So that's a reason that we need more sophisticated immunology, more sophisticated knowledge of the immune system to try to find the weak points in the virus or other diseases. It might be a parasite like malaria. So that gets into the whole area of immune monitoring, which we've been very involved in developing technologies so that we can look very broadly at people's immune systems and say, well, you're doing well, your immune system is healthy, or your immune system is not healthy. And that's a big study we've been doing at Stanford in California, where we've actually just been analyzing an influenza vaccine, so just a standard flu vaccine, which doesn't work very well in older people. In fact, it's not one of the more successful vaccines. It works fairly well in young in adults, but in elderly people, the failure rate is more than 50% for influenza vaccine. So, and nobody knows exactly why. We know the immune system tends to deteriorate in older people, but we don't know why. We don't know. It clearly deteriorates much more in some people than other people. So who are those people? Can we identify those people? Can we develop a kind of cholesterol test for the immune system, health or not health, so that you could be more cautious, for example, where you might be exposed to infectious diseases if your immune system is not doing well.